Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today on the show, we have Stephanie Straeter. She's a psychologist and a behavioral health and wellness program developer. Her Kevin MD article is titled 5 Tips for Treating Seasonal Depression During the Holidays. Stephanie, welcome to the show.
Thank you, Kevin. It's a pleasure to be here with you today.
So we'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Well, I'm a licensed clinical psychologist in Florida, California, New York, and board certified wellness coach. This spring, I will have been with Uprise for 15 years, where I'm a senior clinical reviewer, as well as a behavioral health case manager and wellness coach. And I also maintain a private practice where I treat adolescents, adults, and senior citizens with mood disorders, depression, anxiety, ADHD. For more information about my private practice, people can go to drstephaniestraeter.com.
All right. So you wear many hats. You have a private practice. You also work with behavioral health programs as well. So talk about the different things that you do as a psychologist, and how did you get involved with things outside of your clinical practice?
Well, I was given an opportunity. I was a clinical supervisor at an eating disorder facility in California, and I was given the opportunity to create a wellness program, which required me to move into Florida. And I embraced the opportunity. It was the lifestyle that I pursued. I love working out, being outdoors, and I know the benefit to someone's mental health when they are physically active as well as mindful of their nutrition. So that's how I got into the wellness field and program development initially. And the owner of our company, she was also a psychologist, and we really saw a need in the market for more advocacy when it came to behavioral health. Many people don't know that if they have medical coverage, they have mental health coverage. And since 2010, there's no limit to that coverage as long as they're working with a licensed clinical professional, who feels those services are warranted.
The reason I ask that is I always like to ask clinicians, especially if they work with industry or in a non-clinical job per se, how they got involved with that. Because one of the themes that we have on the show is that we are more than our degrees. We are more than just seeing patients in the exam room or in the office. So did you have any special training to go into some of your non-clinical roles, or is this something that you just took advantage of and learned on the job for this other opportunity?
Yes, actually, I attended Well Coaches. It's a Harvard affiliated wellness coach training program where I took a deep dive in motivational interviewing, the stages of readiness to change, positive psychology, and then personally studied, what makes wellness programs work. What are the aspects of these programs? But no, I pursued, certification in wellness coaching to prepare myself to create these programs.
All right. And my last question on your wellness is before we go into the article. So when one is evaluating a wellness program, just from your perspective, what makes wellness programs work? What makes one better than the other?
I would say having coaches that are board certified. So there's the National Board of Certified Health and Wellness Coaches, and they give their stamp of approval to any wellness coach training program out there. So if someone is interested in becoming a coach, they should look for their approval. So I would say it starts with the coaches, and because they are the behavior change experts teaching people how to approach change in a different way. When an employer can offer their members an incentive to engage, that does help, like a healthcare premium credit or a pharmacy credit, because a number of the people in the population are in the early stages of readiness to change. They're pre-contemplators or contemplators, and they're not thinking about making a change. Sure. But the coaches are so good at establishing rapport with these people that eventually they're able to, there's still work they can do with someone in the early stages that will get them further along to being ready to change. So I would say it's the training of the coaches and looking for that nationally board certified health and wellness coach. They went to a school that was approved by that and that they are certified.
All right. So let's transition into your Kevin MD article. It was written last fall. It's titled 5 Tips for Treating Seasonal Depression During the Holidays. Now, how did this article come together?
Well, it occurs at this time of year. So seasonal depression or seasonal affective disorder most often occurs in the winter and
Mm.
late fall months when we have shorter days and less light. And it's a condition that I've helped my clients to better manage. And the goal of the article was really similar to, our goal as coaches at Uprise, to provide the reader with the strategies and tips to help them better manage the condition.
Mm.
Because if someone has the awareness of what they want to manage and they're motivated, then our philosophy at Uprise is all about prevention. We want to give them the knowledge and tools that they need to do this. Because, Kevin, in this lifetime, the only thing that we really can manage is our feelings. Of course, when we're grieving, that's something different. Or if we have a mental health diagnosis, it can be more difficult, but not impossible. And we don't have an escalation of emotion without something going on in our mind at first. So if someone is aware of that experience and they're motivated to manage it, then if we can give them the tools and knowledge to do this, they may be able to do this without psychotropic medication or therapy.
So, for those who aren't familiar with seasonal affective disorder, can you tell my audience what differentiates that from, say, clinical depression?
Well, they think that it's chemical. I mean, both clinical depression and seasonal depression are due to chemical changes in the brain. But with seasonal depression, they feel it's due to the change in light.
Mm.
And melatonin, a sleep hormone, has been implicated also with seasonal depression. When it's darker, the brain produces more, melatonin. But the presentation will look the same.
So just give us an idea for, let's say in your private practice, if someone comes in for what you suspect as seasonal affective disorder, what would that person look like to you in your office?
They could have a lack of motivation. If they're coming to see me, then they have a lack of motivation. So they're maybe sleeping more, they're not following through with self-care, they're isolating.
So take us into your office. So what are some of these techniques that you would introduce to a client who comes to you with seasonal affective disorder? What are some of these treatments that you would offer?
So for example, I had a single mother who had a seasonal depression and she was having a hard time leaving the house. Then she started to have panic attacks, which was problematic because she had a 5-year-old son that she had to take to school. So she was motivated enough. So what we started to work on was her awareness of when her negative emotions started to rise.
Mm.
And she knew that when it was a 5 or higher, it was time to use her box breathing. So I taught her box breathing. And of course, when you're practicing breathing, the goal is to take whatever was in your mind, write it down and leave it there, and just focus on the breath to bring down the elevation of negative emotion. And practicing that skill at least 10 minutes a day so that when you need it, it's effective. So she was able to prevent a panic attack by utilizing those skills before leaving the house. So it became a regular routine for her to, about 15 minutes before she left the house, would be to do an emotion check. And if it was a 5 or higher, then use her box breathing to bring down that elevation.
Sure. So when you mentioned box breathing, so those who aren't familiar with that, what exactly is that technique?
That's inhaling for 4, holding it for 4, and exhaling for 6. And box breathing is good for stress, anger, anxiety, and sleep. And what happens, Kevin, when our negative emotion is a 5 or higher, our mind, well, as you know, as a medical professional, your mind's telling your body, danger, danger.
Hmm.
And then your body's releasing neurotransmitters to kick off that fight, flight, or freeze response. And that's when people start to have physical reactions.
Sure.
Clammy palms, beating heart. And then their thoughts even get more severe. They start to panic even more because they're experiencing this autonomic arousal. So the box breathing is so effective. The hold and the box breathing is what reverses that autonomic arousal.
Now, what proportion of people do you see can solely be treated with non-pharmacologic treatments? Do you see a small proportion eventually have to be prescribed medication, or do you see the majority of people with seasonal affective disorder can be treated without medications?
Well, I've treated in my lifetime 3 people, I would say, with seasonal affective depression. So I would say out of those 3 people, 2 people were able to do it without medication. And one person came to me and she was already on medication for a while. So, catching it early, I would say is key, catching it early and not being so debilitated by the depression that you're motivated enough to work on these skills.
So I'm a primary care physician, as you know. So if I'm talking to someone in the exam room, so what will be some signs, tip-offs that would make me suspect seasonal affective disorders? What should I be on the lookout for?
Yeah. Well, I'd say the time of year.
Yeah.
So, first off, the fall, the late fall and winter months. And if you're a doctor where it's cold and dark out, that's where this happens, where there's not that much sunlight. And, a person who comes in and when you saw them in the spring and in the summer, there was no symptoms of depression. So it's
Mm.
really the time of the year, knowing their history and realizing that, hey, this person, when he comes in and when it's darker out and there's more rain and snow outside, he's grumpier, because depression can come out as anger, being grumpy, or he or she may not make their appointments. They may not show up.
How about a potential connection with substance abuse? Seasonal affective disorder, of course, happens during the winter months. Is there a connection with substance abuse and these mental health issues, especially during the holidays?
Yeah, I mean, I would say if someone has a addictive propensity and they already have a problem with, drugs or alcohol, then yes, then you could expect to see that they might be using more during these months.
And if someone knows that they have seasonal affective disorder, what are some things that they can do to help prevent these symptoms from spiraling further, especially during the holidays? Anything that they can do on a preventive basis?
Well, I would say, especially during the holidays, it's important for them to not not be so caught up with the media, because there's a lot of pressure for their holidays to look a certain way.
I see.
It's
Yeah.
really about them deciding what's important to them during the holidays, what's this going to look like, and who do they want to see, and making plans to stay connected to the people that they love. And then additionally, technology. There's a lot of technology today that's wonderful. There's lights that they can use in the home. The Apple Store uses it for their people that work 24/7, to help them with, the overnight shift work and helping them to adjust to that. So I would say there's lights that they can use. And then additionally, the tips and techniques in my article, having an awareness that you're having a frequency of negative emotion, being curious about it, and then utilizing, deep breathing, meditation, seeking out a couple stress management techniques that you're willing to practice a couple times a day, like exercise, deep breathing, meditation.
We're talking to Stephanie Straeter. She's a clinical psychologist and a behavioral health and wellness program developer. Her Kevin MD article is titled 5 Tips for Treating Seasonal Depression During the Holidays. Stephanie, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
I would say how important our self-care is as mental health and medical professionals, so that we can continue to be curious and present with our clients and treat the client and not the condition. So I would say undeniably, the more experience that we have with the condition is an asset. When that's coupled with poor self-care, we may fall victim to top-down processing, which is a psychological term for, how our prior knowledge, expectations, and experience with a condition can influence what we're hearing from the client. So instead of being present and curious about what our client is saying, we may be quick to jump to conclusions and assumptions about the client that aren't accurate.
Stephanie, thank you so much for sharing your time and insight, and thanks again for being on the show.
Thank you, Kevin. It was a pleasure.